Minkoff, welcome to the show.
Thank you, Anthony.
I'm very excited to speak with you, and I've been making some connections here that Michelle was pointing out that I was unaware of. You were just recently in the Root Cause documentary.
Yes.
Which my vice president, Carrie, told me is fantastic.
It is amazing. And I think people will like to find out what's really going on.
Tell us a little bit about that film and why you're so proud of it.
Well, I had nothing to do with making it. I have been putting out videos about patients who are sick with things in their mouth that they're not aware of. And I've spoken to many large medical groups about silent problems in the mouth that are causing people to have systemic illness. For example, a person has a root canal. The tooth is dead, it's infected, they have no symptoms. The standard in dentistry is basically that if it looks good and you're not complaining, it's okay. But really, the root canal teeth are infected, and those bacteria produce biotoxins. They leak into the jawbone. The jawbone has the richest nerve supply in the whole body. The nerve that goes to the jawbone comes out right out of the brain. There's no relay point there. So you can get disturbances in other places from silently infected teeth or a silently infected jawbone. So I've had many of these patients, and they, in fact, I'm working on a book right now just as a collection of patients. A patient came to me with severe back pain. This is one that's actually fairly recent. So she was 42 years old. She was a fitness instructor. She was in very good shape. And she walked in here with a 4-pronged cane, bent over on round-the-clock Percocet for severe back pain. And she said, "Can you help me with my back pain? We do ozone therapy here, and many times ozone injected into painful areas can help heal them up." So she was coming here looking for ozone therapy.
Is that prolozone?
It's called prolozone, yeah.
Okay.
So,
we've had Dr. Frank Schellenberger on the show. I believe he's one of the pioneers behind that.
He is the pioneer in the United States.
Right. Yeah.
He's a very close friend.
Oh, nice.
And he's my mentor in ozone therapy.
Okay.
So I learned it from him about probably 8-9 years ago.
Yeah, for those of you guys interested, check out one of the earlier episodes of the Biohacking Secret Show podcast with Dr. Frank Schellenberger on ozone. You'll love it. Please continue, Dr. Minkoff.
Okay, so she comes in with this thing, and I looked at her back, and I asked her what was the story with her back pain. And she said, "Well, I had really no injury, but I started to get back pain about 10 months before. And I went to my primary doctor. He couldn't find anything wrong with me except that I was in a lot of pain. He sent me to an orthopedist. The orthopedist did an MRI on my back. The MRI showed that I had a herniated disc. He tried some local steroids injections. They didn't really work. So he did a discectomy on my back. He carved away part of the disc that was bulging, that was supposedly causing my pain. It was pinching on the nerve and was giving me the pain I was having." So I said, "What happened after that?" She said, 6 or 8 weeks after that, my pain was just as bad, if not worse. And I went back to the orthopedist. He did a reevaluation on me, and he decided that what I needed was called a laminectomy. Now, a laminectomy is they cut the back part of the backbone off. And he did a 2-level laminectomy, L4-5 and S1, on my low back.
Is this standard of care for back pain? Start shaving parts of it off?
Yeah. Yeah.
Interesting.
It's not very successful often, but this is what's done.
Yeah. Do you know what the success rate is with that type of procedure?
It's about 30%.
And they're still doing it. Interesting.
Yeah.
All right.
Yeah. So anyway, and what that means is if you push on her skin over her low back, there's no bone there. You push it right straight down. So I said, "Well, how is that?" She said, "Well, you can see me. I'm not any better. In fact, I'm worse. I'm on round-the-clock pain pills." So I said, "Well, what did he say after that?" He said, "I should get a fusion. Like they should fuse my backbone together, and that would maybe finally take me out of pain." And she said, "I'm leery about doing this because I've already been through 2 surgeries with this guy. He's a competent doctor. You know, he would do what another orthopedic surgeon would do. It wasn't like he did weird stuff to her. And she said, I'm looking for other solutions. And I saw that this thing called prolozone, and I thought I'd come in here and get a treatment from you. So when I did the evaluation, when I see someone for pain, I do a whole body evaluation, and I do a thorough history on them. And what came up in the history is that she had a root canal tooth. And I have a way to test the body using kind of a biofeedback procedure. It's a muscle testing procedure.
Is this like autonomic response testing?
It's autonomic response testing.
Okay, so people know where you have them put out their arm and then test different substances or different modalities to see how they respond?
Right.
Okay.
Right. So this is a way to sort of hack into the controlling part of the nervous system that runs the whole body.
Awesome.
If you think of the body, you know, it's a whole group of individual cells. You could take a skin cell and a brain cell and a spinal cord cell and a breast cell, and you could put it in a tissue culture and you could grow it. It's an independent living organism, each cell in the body. And cells have reaction rates of about 2,000 times per second, so they're very busy. They have to take in nutrients, they have to manufacture their own energy, they may be making proteins or other things, and they have to get rid of waste, so they're very busy. Now, in an average-sized body, there's around 100 trillion of these things. So if you want a good problem, if you're a computer type guy, try to figure out a networking program where you could have 100 trillion individual cells, that each of which is reacting at the rate of 2,000 times per second, where at every nanosecond, everything knows what everything else is doing, and it's all adjusted so that you can sleep all night and your heart beats, or you can run, or you can jump, or you could go to the top of Mount Everest, or you could go to the bottom of the Dead Sea, and the system would work. Okay, it's impossible. Nobody understands it. Nobody understands it. It's impossible. And then package it in the size of a brain and spinal cord, or even package it in a size this big. There's no computer network that could do it, and there's sort of no even artificial intelligence where this thing could even operate. Anyway, that's what a body does every day for 70 or 80 years, whatever it is, and it does a pretty good job. So by using this autonomic response testing, we can tune into this operating system and find out where the stressors are. So I put her on the table and I tested her to see what was the biggest stressor going on in her body according to her own autonomic nervous system. And what came up on her was jawbone osteitis.
So how niche do you go with these tests?
Well, it's pretty niche. It's very specific.
I mean, you're not going adrenal fatigue, heavy metals, glyphosate. You're really getting in there.
This is very specific because if you get the exact one, the body will feed back to you that is the one. So if let's say it's toxin A and you put on toxin A, there is a reflex created in the body that tells you, yes, that's the one. But if you put on toxin B, even though it might be kind of similar, it won't react to it. Now, our body is really an energy sensing and relaying device. You know, if you think of it, how do we get communication from the outside? It's all energetic.
Yeah.
So light waves come in and you see. Now, you don't just see, but it can produce reactions in every part of your anatomy. You see something very beautiful. You might have a whole array of emotions. You might cry. You know, you see a car accident where someone's hurt really badly. You might throw up. You might faint. You might feel very afraid. Your heart will beat fast. This is on a single energy input. Okay? Sound is the same way. So our bodies are energy sensing devices that relay this information to the rest of us to do some kind of appropriate reaction so that we can survive. You know, so that the body can maintain homeostasis, it can stay alive, it can adapt, and we adapt pretty well. You know, if it gets too cold or too hot or, you know, too much pressure or, you know, then the body can't cope. But this part of our nervous system is built so that it can arrange things so that everything will work. And so when we test it, if things are blocked, if they're not working, it knows what the bad energies are. It doesn't know in a no sense, but it knows in an energetic sense. It's almost like a virus in a computer. Does the computer know what the virus is? No. But there is an energetic wavelength. There's a piece of material in there made of energy which says, don't send when you push send, or don't do this, or crash the computer, or whatever it is.
Causing an interference.
Causing interference. It's a block in communication, or it's new communication that shouldn't be there. So the body is built kind of like, we have a biocomputer, so it's built kind of like the same way, and so we have this thing that will, when you put the right frequency there, it goes, yeah, that's the one. And it produces a reflex, a measurable reflex.
This is why people like Harry Massey are using energetically charged water with different frequencies. That's a part of homeopathy. That's why pulsed electromagnetic fields are getting so much use and like those types of devices. Yes. And why people are becoming a little bit more conscientious about how much time we're spending on our phones or working at desks with a Wi-Fi router between our legs.
That's right, because it's all energetic inputs.
Yeah.
And some of them are beneficial to the body, and some of them are harmful to the energetic systems of the body. And these ones that are locked in there, so we're in an environment where we're in there's a lot of toxins, okay? Like there's never been more toxins around us than now, even if you're careful. You know, the amount of toxins in the water, in the food, in the air, on cosmetic products or skin products or lotions, we're just getting inundated with this stuff, and these things can get into the body, into the cells, and they can cause disturbances of this relay system, okay? And so we have an epidemic of chronic illness. A lot of it is because of this stuff. We're putting things in our body that shouldn't be there. So if you look at it this way, so I tested her for, and for those of you that are into physics, this is biophysics, and this is resonance. So I don't know if you want to see this, but I could show you with a couple of tuning forks if you want to.
Sure, let's do it. We got the camera going too for the people that are watching.
Michelle, can you run over there? See that little bucket over there? There's 3 tuning forks in there.
I like this. We get some experiments going. Everybody likes show and tell.
Okay. Now, so what is bioresonance? So here's a demonstration. These are 2 tuning forks. This is middle C. It's 256 cycles per second.
Okay.
Now, if I put these up to the microphone...
And that's the same as 256 hertz, correct?
I think so.
Okay.
So these have no sound now. If you just listen to them.
Yeah, so he's holding 2 tuning forks up to the sides of my head.
No sound.
I don't hear anything.
Okay, now, I'm going to bop one of them on my shoe.
Okay.
Okay? And now, you can hear that.
Yep.
Now I'm going to hold it next to this one for about 2 seconds. Now listen to this one.
Ah.
Okay?
Wow, yeah. So he took the tuning fork, bopped one of them on the bottom of his shoe, held it up to my ear and I could hear it. Then he took it and just put it close to the other tuning fork. The other tuning fork then picked up the frequency. He then put the tuning fork that was not banged against his shoe up to my ear and I could hear the frequency it was emitting.
So this is a sympathetic vibration. This is called resonance in physics. Okay? Now, if we try it with, if you look at this, these are 2 different size tuning forks.
The previous 2 were the same,
The
256
previous 2
hertz.
were both 256 and they look identical.
Yep, they do.
The second one is bigger.
Okay.
And this has a lower sound, and this is low C on a piano. This is 128.
Okay.
Okay, so it's half the frequency.
Gotcha.
Now, if I do the same thing, I bop this one, you hear it, I put it next to this one, the lower one, and then you listen for it.
Nothing.
You don't hear it. It won't pick up the sympathetic vibration. It turns out that in our bodies, the nervous system, when it's tagged onto a toxic thing that is highly affecting the organism, it knows that frequency, and when you put something that's the identical frequency in contact with the body or near the body, there is a resonance between the 2, and that resonance, that vibrational resonance, creates a response in the nervous system which makes a strong muscle go weak. It actually blocks the nerve flow to the muscle, and that's why it goes weak. So there's a very eminent teacher of mine. His name is Yoshiaki Omura.
We'll link to these in the show notes.
Okay. He is the inventor of something called bidigital O-ring test, and you can Google bidigital O-ring. And if you go to the website, you can watch some amazing videos of experiments that he did. He is at Columbia in New York. He's been there for many years. He's a very esteemed professor there. And he has done the experiments which show that when you get this resonance phenomena, if he has an electrode on the nerve and another electrode on the motor strip of the brain where the impulse is originating from, so the guy makes his arm strong, there is nerve flow here and nerve flow to these, let's say, the shoulder.
Right.
When you then put the tooth, let's say the guy is toxic with toxin A, and you put toxin A in contact with him.
This is in a vial?
In a vial.
Okay.
And you do the challenge. What you see is the muscle, the nerve fiber will fire at the motor strip, but there's about a tenth of a second pause in the firing at the motor end plate, and that's why the muscle goes weak, and you can see it on the oscilloscope.
So it is a quite literal interference.
It is a literal interference. And that's why muscle testing works in the hands of someone who knows how to do it.
That's what I was going to say, and I know that we'll circle back to this story from root cause of one of your patients. For someone who's listening to this and they're fascinated by the concept of autonomic response testing, they're able to suspend disbelief long enough to say that could be something that may benefit me. How do you even go about finding someone who is proficient and competent?
Why don't I give, there are groups that teach it where you can learn it. There's actually one here in town. It's called ULAN Training Systems, ULAN. Actually, it's ULAN Nutrition Systems, where people who are degreed in health, it can be chiropractors or acupuncturists or massage therapists or medical doctors, where you can actually learn how to do this so that you could utilize this in your practice. And he's right here in Clearwater, trains a lot of doctors. A couple of my staff have been trained down there. And if they do UNS.com, I think is the website, they can get the information from there.
Beautiful. And you were telling me before we started recording that 30% of your current clientele fly in from all over the world to do this with you and your team.
Right.
Okay.
Right. We specialize in chronic illness, cancer, Lyme disease, Parkinson's, Alzheimer's, people who have autoimmune things, rheumatoid arthritis. So you have to use this kind of testing along with regular medical stuff if you're going to help people to figure out what's wrong with them. Because normal, regular medical stuff with normal lab tests, you won't get it. And why do most doctors resort to heavy doses of pharmaceuticals? They're trying to help the patient, but they don't have the tools that they need to find what is the biophysical phenomenon that's going on and what are the exact items. Like you talk to someone who's got rheumatoid arthritis, and the doctor will put treatments on to block the immune system from causing that person to have pain and to decrease the inflammation. But rheumatoid arthritis is a great big wastebasket. It's not really a diagnosis. Mm-hmm. If someone came in here with...
You say it's a great big wastebasket, you mean it's like a collection of symptoms that we've given a name.
That's right. But etiology, there is none. Right. There is none single one known. Now, if you just compare it with someone, say, comes in with a really sore throat, they have a fever of 102, their tonsils have pus on it, they got swollen lymph glands, and I take my swab, and I do a swab of their throat, and I do a rapid strep test, and the strep is there. Now I've got a real diagnosis.
Correct.
And I've got a real treatment. Okay? I give them penicillin or silver or oregano oil or something that will kill the strep. And in 3 days they feel better, and in a week they're fine. So that's a real diagnosis. A guy's got a broken arm, it's a real diagnosis. A ruptured appendix, it's a real diagnosis. What is Alzheimer's, lupus, rheumatoid arthritis, chronic fatigue syndrome? They're all great big wastebaskets of who knows what. And what we're trying to do is we've sort of narrowed this down. There's sort of two big categories that are causes underlying of everything. One of them is the person has something in their body or some things in their body that shouldn't be there. Toxins, infections, things like that.
And toxins are kind of an infection, infections are kind of a toxin in and of themselves.
Correct.
They're releasing their own metabolic wastes and
right.
causing deficiencies in some cases.
Right. And then many times people are very deficient in things. You know, they're low selenium or low zinc or low essential fats or low amino acids, and the body can't quite cope well enough. So as we look for these things, we can kind of unwind these things with people because, yeah, they got a parasite and they got Epstein-Barr virus and maybe they've got Lyme and they're missing selenium and zinc and they got 3 bad bacteria growing in their intestine, and you start to find these items and you start to handle these items and they start to feel better because now their nervous system is being unburdened and the body is built to heal and work well, and then it can start to heal in many cases, you know, as long as it's not too late. So let me cycle back to this patient. So the patient comes in and I test her, and the vials that I tested said jaw osteitis, jawbone osteitis. Osteitis means inflammation or infection of the jawbone. So I said to her, and that's the thing that came up as the most significant item. And I asked her, because she hadn't written anything down on her intake sheet about her dental health. We do an extensive dental history, but she hadn't written anything down. So I said, did you have a problem with your teeth? She says, well, last year I did. Well, tell me what happened with that. She says, well, I had a toothache, and I went to the dentist, and he did a root canal. And the toothache persisted for a month or two, and I went back to him, and he redid the root canal. So he redid the procedure, okay? It didn't handle for me. It didn't get any better. So what he did was he pulled the tooth, he put a graft in to build up the jawbone, and he put an implant in my jawbone where that tooth was. So I said, when was the tooth, all this tooth stuff, in relationship to your back pain? And she thought for a second, and she said, well, actually, it was right before. I got the root canal, and then I had it redone, and then my back started to hurt, and then I was going down that pathway at the same time the dentist was handling my teeth.
Is that when you drop the mic and you walk up and give Michelle a high five? We got it. Got another one.
I didn't have it yet. But I know I'm onto something.
Yeah, you're hot on the trail.
I'm sniffing and I've got a scent. Okay? So I said, when you bite down that tooth real hard right now, how does it feel? She says, well, it doesn't feel right. So I said, well, what did the dentist say? There's an endodontist, there's a specialist in this. I mean, the guy is a professional in doing implants. Okay? More school, another year of school to just learn how to do this. Okay? And she said, well, it was still tender. And he said, well, they can be tender for a year. Just hang in there. I think it'll be okay. So she hung in there, but it wasn't any better. So I said to her, I'm going to do an experiment on your tooth because I want to see, is the tooth related to the back or not? Okay? Doctors know about things called referred pain. Okay? You have a problem one place and it causes pain in another place. So I took some Novocaine and I injected it all around that tooth and I blocked the tooth. So now the tooth is not in communication. The tooth, this is an implanted tooth, okay? I blocked the tooth and I said, let's just sit here for 15 minutes and let me go out. I'm going to see another patient. I'm going to come back here and I want to see how you're doing. And when I came back in, she was standing next to the exam table and she had her hands on her hips. And she was doing side bends, both sides, and bending, and she said, the pain is 80% better.
Just from Novocaine?
Novocaine in the tooth.
Localized,
causing a change in the low back pain, which was severe. Remember, she walks in, she's got a 4-pronged cane, she shuttles in. She's not, and this is a fit woman, you know? So I said, good. I think the two are related. But I want you to come back in 3 days and do it again, just in case this isn't some sort of psychological reaction that someone did something to you and now you blocked it yourself. She said, okay. She comes back in 3 days. I did it again. I got the same reaction. And I was a little nervous, frankly, about having to call the endodontist and tell him that the tooth was related to the back pain. Now she's already got 10 grand into this tooth. A root canal, another root canal, a bone graft, and an implant.
And she's thinking, great, I'm going to sue this guy and get my money back.
I don't think she was thinking that. But I said, let's do it 1/3 time, just to make sure. And she said, nope. I'm calling him right now. So I said, let me call him and tell him what the story is. So I called him and he said, I have seen referred pain before from a tooth like this, causing headaches. He said, I haven't seen anything like this. Let me laser it a few times. Maybe I can get it to come around. He's a good guy.
Yeah.
And he lasered it a couple times and made it worse. He pulled it.
Okay.
He pulled the implant out.
Was he hoping the laser would work like, say, an ozone to kill the infection and boost the immune system there?
Yeah.
Okay.
Yeah, and reduce the pain.
Okay.
But it didn't have any effect, and it didn't work.
Okay.
And so he took it out. And I had her come back here in 6 weeks, and she was off the Percocet, and she was feeling much better. She still had some low back instability because she'd had all this surgery in her low back. I did some prolozone on her back. Within a year, she was really like almost fine. Not on any pain pills, functional again. And the cause of the problem in the back was the tooth. Now, because dentists aren't following...
An infection in the tooth?
Well, an inflammation at least in the jawbone at the location where the implant was, but I suspect there was some infection in there too. I don't think he did a biopsy at that point, but sometimes they'll do biopsies and prove, yeah, there's infected bone there. That's the problem.
Right.
But whatever it was impinging on the nerves going back into the brain, and it was being referred to her low back.
This is fascinating.
It's very fascinating because if you look at this in a wider context, and my idea isn't that dentists are wrong or endodontists are wrong, or that every procedure that they do is bad. I don't think that's true.
And neither do I. Most of the time I'm just joking around. You guys know that.
Yeah. But what is really important is that dentists and doctors have to work together, because people can be causing things which they don't realize are causing things other places. Now, if this dentist on the follow-up was tuned into maybe a tooth can cause low back pain, or a liver cyst, or what about high blood pressure, or what about a high cholesterol, or what about arthritis, or what about heart disease. In the 30s, Weston Price, who was a dentist, did some experiments where he was looking at, he thought that root canal teeth were a problem because the tooth remains in the body and is infected. And I think something like 900 cases, he took root canal teeth out of people who had symptomatic disease. They had chronic heart failure or arthritis or something like that. He implanted the teeth into rabbits, and within about 6 months, the rabbits started having the symptoms that the patients did. And like over 90% of the time.
He was putting human teeth in
under
rabbits?
the skin of rabbits.
Oh, under the skin. Wow.
And the rabbits were getting toxic with symptoms that were very close to what the patient had. And he wrote about this. This is I think in the 30s. So this has been known for a long time. And I think the problem with modern medicine is there isn't good follow-up on what happened to the last 10,000 guys that got root canals. Is their incidence of arthritis, heart disease, cancer, autoimmune disease, is it a lot higher than people who didn't get that procedure? Maybe there's a connection. Maybe there's a better way than my autonomic response testing to start to look into this and follow it, so that we don't, iatrogenic illness, which means illnesses caused by doctors and probably dentists, is the third leading cause of death in the United States. Okay, like somewhere between 275,000 and 400,000 people a year die from iatrogenic illness.
275,000 to 400,000 people every year?
Yeah, that's the estimate.
And roughly like 100,000 plus of that is just the drugs, right?
Well, it's drugs, it's diagnostics, it's reactions to medical procedures and or treatments. There was just this in December or January, I think it's the Journal of Pharmacy, but I can get you the reference. The downside costs of iatrogenic illness were close to $500 billion, including 275,000 deaths. And it's probably a low estimate. because on the death certificate there isn't any line for doctor caused death.
Right.
So probably it's being underestimated. It's a huge problem. It's a huge problem. You know, the FDA and medical boards are really there to protect the public from bad medicine. And these things are problems. It's not that modern medicine is bad or there aren't wonderful treatments for certain things. But I think that there is a downside to it that has to be looked at really carefully so that the job of protecting the public from bad care, it's not, doctors are trying to do their best. I know that. They're there to help people. But there is a downside to treatment. And if you just go back to Hippocrates of do no harm, we have to really look at that. So my idea is that if we can start looking at these things together and what are the downsides of what we're doing? What are the upsides of what we're doing? What treatments really do work? What treatments really don't work? Then I think we get a better system and we get better outcomes for people.
I couldn't agree more. And that's a big part of what I love about what you guys are doing here at LifeWorks Wellness Center is you're helping people overcome challenges that they've probably tried to solve within the parameters of Western medicine and have been unsuccessful. And along with that, you're empowering them to take control of their own health and learn skill sets like we're talking about here, where they can have better, more accurate diagnoses and treatment options that get to some of those root causes and toxins that you were mentioning earlier.
That's right. And so the guy from Australia saw a video that I did having to do with the patients that I had seen where the root of their problem was an infected root canal tooth. And one of my patients was a dentist who had chronic fatigue for a couple of years and she couldn't work. And she came here and we did our treatments on her and she got better. And she got interested in how we were looking at things versus her traditional medical education. And so she was the chairman of the local dental society's program chairman for their monthly meeting to have speakers come. And she said, would you come talk to the dentists about this idea that you're talking about? That there could be dental problems that are causing people to have medical type situations. And I actually went there and spoke to a couple hundred dentists in the local area about this problem. And what was so very interesting is they were very amazed that this was even, that this could even be. And my message to them was, we really need to work together because we are both affecting people's health. And if I'm open to what you're doing and I'm alert to what you're doing, that maybe it's a problem, then we can have a cooperative effort. And I found that it was I wasn't sure what was going to happen if I went in there and said this, but really they were very receptive to the idea. And I even get referrals from some of those people now.
I love that so much of modern medicine, whether you want to call it integrated medicine or functional medicine or whatever your preferred vernacular is migrating towards collaboration and cooperation and sharing information, avoiding some of the things that kind of got us in trouble over the past 100 years when we started trying to make everyone specialists and so myopically focused that they lost sight of the big picture.
Correct.
And this is fascinating to me because you're using mainly autonomic response testing. Have you found any success or heard of anyone successfully using cone beam technology for finding some of these dental infections? Dr. Dan Pompa had just recommended that I get that because I got smashed in the face with a baseball growing up. And,
well, you have to watch root cause because you'll see it's the same story.
Yeah, it would explain a lot.
Yeah. Anyway, so I'm trying to document this not just on an autonomic response testing. So last year I sent the dentist down the block 143 people. Because on my autonomic response testing, it said there is a dental problem. It might be a root canal or jaw osteitis or something else called a cavitation. It's where there's a hole in the jawbone where the tooth was pulled. And on 143 of those people, 140 of them on cone beam CT. So this is a three-dimensional X-ray of the teeth. Only about 5% of dentists have this technology. Most dentists have a two-dimensional x-ray, and it's just not enough resolution to see what you have to see. So this dentist has one, and he's doing now care for my patients. But I send them down there, and last year out of 143, 140 of them showed positive evidence on x-ray of either cavitation or root canal abscess or jawbone osteitis on the x-ray itself.
Wow. What's his name? I'll pop over on my way home.
His name is Paul Rodigero.
We'll link to it in the show notes.
And you don't even have to actually see the dentist. I have an arrangement there where I can send people over there. I give them a script, they go over there, they're in and out in 10 minutes. He reads the films, he calls me within a week, and I get, yes, there's an abscess at root canal tooth 19 and 20, number 18 looks okay, so we go for the ones where we actually see disease.
That's brilliant.
Yeah. And people, when they have this as a high-level problem, in my experience, if you have cancer or autoimmune disease or Parkinson's or Alzheimer's or severe chronic Lyme disease, and you've been through a lot of smart doctors and their treatments haven't helped you, my experience is you will never get better until you handle your mouth. It has to be in good shape. No infection, no bad materials, metals. You have to have the mouth cleaned up, then the body can get better.
That is probably the biggest piece of advice from everything we've talked about so far. And it's much more difficult than just looking up a biological dentist and going to the first person you find in the listings, because, as you mentioned, a very small percentage of dentists and biological dentists have the cone beam technology.
Right.
And what I found is, because I'm interested in this for myself, as I mentioned, I ate a baseball in 8th grade going into high school playing third base and broke all of this. And I've done periodic nasal rinses where I'll do like a drop of Johnson & Johnson baby shampoo and some water, and felt tingling and a sensation where I'm like, there has to be something going on there that's being impacted by this.
Right.
But you call certain biological and conventional dentists, and they'll have a cone beam, but maybe it's just for implants.
Right.
It's not necessarily for doing what you're talking about, which is finding these hidden infections and
Right.
root causes that are often overlooked.
Right. And I think the other part of this, which is important, because I got into this field because my wife was mercury toxic from her teeth, from a dentist who improperly removed the mercury in her teeth. And she got very sick with it. And that's what got me into this, because I was an emergency room doctor before that. So I think the other thing is, I advise people, don't just go to the biological dentist and say, I want all my mercury taken out, or I want my da-da-da. That I think it's better if you sequence it with someone who knows how to test you, so that you can find the priority things and do it in the sequence that's needed, so that you are following the lead of the body, the native intelligence in the body of what to do. I have had patients who said, I hate the mercury in my teeth, and they went to a dentist who took it out improperly, and then they got sick. And that wasn't a good thing to do. So I think there is a professionalism that goes with this, and people hear it and they get excited, but I think you need to consult practitioners who understand this. They can do the proper testing on you and the proper evaluation, so that you get the right result from what you're trying to get.
I love it. Are you ready for a rapid fire round?
Yeah.
All right. So you talked about using autonomic response testing and finding an infection in this girl's jaw. What would you say are the most common root causes that people are missing that you see here?
Dental is big.
Okay.
Parasites are big. Okay. Environmental toxins are big.
Heavy metals, is that one of those environmental toxins?
Heavy metals, but also glyphosate, benzenes, gasoline additives. People are exposed to this stuff all the time. They have no idea. We test people for this stuff, and here's just a quick story.
Yeah.
12-year-old, out of school 9 months, severe fatigue, can't think. Saw all kinds of doctors. Nobody could help her. They brought her in here, and I did this environmental toxin panel on her. Okay, And on the environmental toxin panel, there's like 25 things. 24 were all in range.
Is this the GPL?
This is a GPL tox.
Okay.
This is
we'll link to that in the
Great
show
Plains
notes too.
Laboratory. Okay, it's a wonderful test. The one item that she had that was astronomical was called MTBE, HTBE. These are gasoline additives. They're octane boosters, and they're in gasoline. Okay? Normal is probably under 500.
Okay.
Most people we see may go up to 1,000 or 2 just from an exposure either from their groundwater, because they're not filtering their shower and their drinking water, or they're in an environment where there's a lot of fumes and they get the fumes. So maybe up to 1,000 is acceptable, maybe even 2,000. Hers was 39,000.
Whoa.
The laboratory called me because they're like, where did this come from?
She's drinking it for breakfast.
Well, I didn't know what she was doing. So parents came in here, I talked to them, I said, is she sniffing gasoline? Is she washing in gasoline? What is she doing with the gasoline? And they said, she decided last year that she was going to be the next Danica Patrick. Okay, Danica Patrick is a NASCAR driver.
Yeah.
And so she wanted to be a driver. And they started giving her lessons to drive midget race cars 2 to 3 hours Saturdays and Sundays. She's on a track, it's enclosed, and the gas fumes that she's smelling from this thing have poisoned her brain.
Wow.
And when we found that, we found the key to getting her better, because we had to detox all these fumey things, and she had to stop doing that, and she got better. So it's that kind of thing. If you test widely and broadly to find out what are these things that are but most of these people, 2 years before or 3 years before, they were fine. This isn't a genetic defect. This is they're poisoned and they're malnourished, and they weren't born this way, and they can reverse it in most cases. You just have to find a doctor who's not fixated on a prescription pad and a 6-minute visit. It takes some real digging and talking with people and repeat visits and repeat testing to find out, hey, we are looking for the why items of why you're sick. There is a why. And when you find the why, then there is a handling for that, and you can reverse the process.
I love it. Last 2 rapid fire questions. The one test you would recommend if someone suspects they may have parasites?
It depends on their money. A lot of stool tests aren't any good. I like the stool test from Diagnostics. It gets it more often. I think if you find somebody that's a really good autonomic response tester, they will find the parasites. And they're there. And when you treat for the parasites, and usually there are herbal remedies that work, essential oil and herbal remedies that work, you will feel the difference in yourself. You might see the parasites coming out, and you will feel better. I wouldn't waste my time sending it to a standard laboratory, because usually they don't get them. They're just not experienced and they're not looking for them.
Beautiful. Last question. What shower filter would you recommend for people that don't have one?
It's like $30 on Amazon, and you just unscrew the regular shower filter, you screw it in, and then you put your own shower head back on.
Yeah.
And change them every 6 months. They're like $28 or $30.
Are these like the rain shower ones or something like that?
Yeah, I mean they say they'll take out fluoride and they'll take out a lot of the junk that's in the water, and it's better than nothing. The best thing is a whole house system.
Yeah.
Okay. Where the water comes in and it ends up where the whole thing's filtered. Because when you shower, you are like drinking the water, and if you're not filtering your shower water, you're getting a lot of stuff. In our water here, there's 500 known toxins.
Oh, wow.
Okay? We don't have bad water. This is just what cities are. You go up to Flint, Michigan, or one of these places, and the water's full of lead for the last 50 years. You got all these people that are poisoned. Because the government isn't testing this stuff to the standard that you need for good health. So you have to take this on your own if you're going to be healthy.
Totally agree. Dr. Minkoff, thank you so much. For the people that are listening and love this, LifeWorks Wellness Center in Clearwater, where else can they stay up to date with you, what you're working on, or come and potentially see you guys?
I have a product company called bodyhealth.com. There are tons of videos on there and lots of information and stellar products to help people get healthier and stay healthy. So those are the 2 main places where you can find me.
Great. Thank you so much for doing this. I know you've got a busy day of patients, so I appreciate it. Thank you again.
You're welcome. Thanks for coming.